This is not going away. The Republicans passed this tax bill today with major benefits for corporations. They gutted part of Obamacare. But there's something else we want to bring to you tonight, as promised. They also failed to renew a key health care program that covers 9 million children. Two top senators today saying Congress will try to pay for this CHIP program next year. No guarantees, though. And that means that families will be going through the holidays saddled with worries no parent should have to bear. Some states already starting to run out of funding and shuffling money around, covering costs short term. By the end of January, estimates say 16 states will be out of money for kids. Families in Colorado receiving new notices that insurance will be cut off. The concerns are widespread.
As a mom, to not be able to get help for your child when you need it is devastating. It's difficult to go through.
CHIP isn't, if little Sally happens to break her arm, or for us, it's to keep him alive.
I think actually everybody would be outraged. It's very important, just as important as school.
Those are real people. In a moment, I'm going to speak with more of those affected. Ariel Houghton is a Pittsburgh mother whose 2 children are covered directly through CHIP, along with her family's pediatrician. Pennsylvania, one of the 16 states that would run out of CHIP money here by January. But first, for a policy view, I go to Connecticut Governor Dan Malloy. Governor Malloy, Congress did claim they were going to act by this week. They are not. How is that failure hitting your state?
Well, we've already started giving notice to the folks who have these 17,000 children in our state that this program will be out of money.
You as a state, you've had to start telling people you don't think it's going to work out.
Well, yeah, we have to prepare them because there are steps that they can take to access potentially other avenues, but most of them won't be able to do that. But so we're letting everyone know that this program runs out of money at the end of January. We're going to cut off people coming into the program as of December 23rd, so we'll take no new enrollees at that point or after that point. And this is 17,000 children who otherwise would not have access to health care. Many of these children with chronic conditions. This is devastating. And the idea that you have a bunch of people going to the White House to yuck it up and tell the president how great he is, but they'd cut off 9 million children from health care makes no sense at all. And by the way, where will these children end up? They'll end up at the emergency room, where some of the most expensive care is given on a non-reimbursed basis to the hospitals. It makes no sense. It's bad for our economy. And to see people celebrating what they did today to give away $1.5 trillion to very wealthy people and then turn your back on 9 million children in our country in a program that is 20 years old is disgraceful, and they should be ashamed of themselves.
Yeah, strong words, and I understand where you're coming from, particularly when you look at the priorities revealed and something that used to be bipartisan. This also, though, I think is starting to break through in the culture. This was Jimmy Kimmel talking about this very contrast you just discussed.
I've had enough of this. I don't know what could be more disgusting than putting a tax cut that mostly goes to rich people ahead of the lives of children. Why hasn't CHIP been funded already? If these were potato chips they were taking away from us, we would be marching on Washington with pitchforks and spears right now.
I know a lot of weird things are happening this year, but have you ever seen late night comics talk about CHIP and what it means, to people in your state?
Well, I think you're talking about a very special guy who's taken his personal experience and applied it to the country, and he's to be congratulated for it. No, but have you ever seen Washington and the state it's in? Have you ever seen, as your last guest, was making up things and trying to throw aspersions on Mr. Mueller? Weird things are happening, but the weirdest one right now is they will not renew a program 20 years old that has saved lives, cut costs, and kept families together. They won't renew that, but they'll give billionaires billions of dollars.
And it's that stark. Governor, I know, I will say this. We talk to chief executives sometimes who say, well, they'll only appear in interviews alone. But when we mentioned to you that we wanted to also bring in some real people in the conversation, you were very welcoming to that. I appreciate that. So as promised, I want to bring in Ariel Houghton, who's a mother of 2 children that are covered through CHIP, as well as her pediatrician, Dr. Todd Wolin. And starting with Ariel, both of you, walk us through what this means for your kids.
Well, CHIP is a very important program for my family. I mean, what it means for me is that I know that I can take my kids to the doctor without having to pay a very expensive copay. And, you know, sometimes if you have to pay like $150, you ask yourself the question, like, is my child sick enough to go to the doctor? And if you wait, sometimes that can be very dangerous for your child.
Yeah.
Just like in my family, there have been 2 cases where waiting would have been very dangerous. My daughter, when she was 2, she had like a rash on her face and a fever, but nothing too serious or grave. But when we took her to the doctor, they said that she had Lyme disease and had to be treated with antibiotics immediately, right? Because you know there's a certain window for treating Lyme disease. And a similar situation with my son. I mean, he was only 4 days old, and he seemed a little like tired. He wasn't eating very well. So again, I just had this feeling that I should take him to the doctor, and I did because I could, right? And the doctor looked at him and said, he looks a little yellow, he might have jaundice, let's get his hemoglobin tested. And we were on our way home after having his hemoglobin tested, and the doctor called me and said, you have to go to the hospital right away. Your child's bilirubin levels are very high, and if you wait any longer, he might have brain damage.
Wow. And Dr. Wolin, can you speak to this in the planning process? Because it seems obviously counterproductive for Congress to do this in a way that adds uncertainty that otherwise wouldn't be there.
Yeah, Ari, the uncertainty is the key. I don't know what to tell families. Ariel and I have talked before, and I don't know what to tell them. Usually, if it's a matter of getting help for a child that needs care for a developmental issue or an acute illness or cancer, right? I have additional resources for families. CHIP is that fallback plan, that additional resource. There's no backup to CHIP. So families that don't make enough to have a good health plan and make too much to get Medicaid, this is the backup plan. If you get rid of this, there's literally nothing. I have nothing to offer her or any other family who says, what do we do now? I don't know what to tell them.
Yeah.
Governor?
Well, I mean, the doctor, both of these people are spot on. What ends up happening in these situations, and clearly what was happening before 20 years ago when CHIP came about, is people didn't get treatment, their children got sicker and had very expensive treatment or died. Before this program, there were not these options. By the way, I want to be very clear that the vast majority of people who are receiving this benefit are from working families, but they don't make enough money to afford other policies. Now, we'll try to hook. One of our things in Connecticut is we're going to review everybody's policy and try to give them options, but those options may very well be unaffordable for these working individuals.